Good day to all of you. Today we will discuss a very important part of our body, the thyroid gland. This small, butterfly-shaped gland sits at the front of our neck and plays a huge role in our overall health. Think of it as the engine of our body, producing hormones that regulate our metabolism, which is how our body uses energy. These hormones affect almost every organ, controlling our heart rate, body temperature, and even how fast we burn calories. When the thyroid is working properly, everything runs smoothly. But when it produces too much or too little hormone, it can lead to various health problems that we need to be aware of. There are several common conditions that can affect the thyroid. One is hypothyroidism, which happens when the gland is underactive and doesn't produce enough thyroid hormone. This can make you feel tired, gain weight, feel cold, and have dry skin. On the other hand, hyperthyroidism is when the gland is overactive, producing too much hormone. This can cause weight loss, a rapid heartbeat, anxiety, and sweating. Another common issue is the development of thyroid nodules, which are lumps that can form within the gland. Most of these nodules are harmless, but some need further checking to ensure they are not cancerous. It is very important to understand these different conditions because their symptoms can sometimes be vague and mistaken for other health issues. For example, feeling constantly tired might be dismissed as just stress or lack of sleep, but it could be a sign of an underactive thyroid. Similarly, unexplained anxiety or palpitations might be attributed to life's pressures when it could be an overactive thyroid at work. Recognizing these signs is the first step toward getting the right diagnosis and treatment. Listening to your body and noticing these changes can make a big difference in managing your thyroid health effectively and preventing more serious complications down the line. Therefore, paying attention to our thyroid is crucial for maintaining our well-being. A simple blood test can often tell your doctor how well your thyroid is functioning. If you experience persistent symptoms like fatigue, unexplained weight changes, mood swings, or notice a lump in your neck, it is always best to consult a doctor. Early detection and proper management can help you live a full and healthy life, even with a thyroid condition. Remember, knowledge is power, and understanding how this small gland works is your first line of defense in protecting your health for the long term.
Perfect.
Now let's talk about a very serious condition called Myxedema Coma. This is not a separate disease, but a life-threatening complication that arises from severe, long untreated hypothyroidism. When thyroid hormone levels drop dangerously low, the body's functions can slow down to a critical point. This can lead to profound lethargy, extreme confusion, a dangerous drop in body temperature, and slowed breathing and heart rate. It is considered a medical emergency because if it's not treated immediately in a hospital, it can be fatal. It is very important to know that this is a functional problem of the thyroid, a severe lack of hormones, and is completely different from thyroid cancer. The triggers for myxedema coma often involve a person with pre-existing, poorly managed hypothyroidism who experiences a significant stressor. The most common trigger is an infection, like pneumonia or a urinary tract infection, which puts extra demand on an already struggling body. Another major cause is when a patient stops taking their prescribed thyroid hormone medication, levothyroxine. Other factors can include exposure to extreme cold, major surgery or trauma, or certain medications like sedatives or opioids that can further suppress the body's functions. The combination of very low thyroid hormones and a new stressor is what pushes the body into this critical state. It is crucial to distinguish myxedema coma from other thyroid problems. This condition has nothing to do with the size of a goiter or a nodule, and it is not connected to thyroid cancer like papillary thyroid carcinoma, or PTC. Myxedema coma is purely about a severe lack of hormone production, leading to a systemic shutdown. PTC, on the other hand, is about abnormal cell growth within the thyroid gland. A person can have PTC without having any hormonal imbalance, and a person can develop myxedema coma without having any cancer. They are two very different medical issues that affect the same gland. Preventing myxedema coma boils down to consistent and proper management of hypothyroidism. If you have been diagnosed with an underactive thyroid, it is absolutely vital to take your medication as prescribed by your doctor every single day. Do not stop taking it without medical advice. Regular checkups and blood tests are also necessary to ensure your hormone levels remain within the normal range. If you have hypothyroidism and start to feel very sick, especially with an infection, or if you feel increasingly weak, confused, or cold, seek medical help immediately. Early intervention can prevent the condition from progressing to a life-threatening emergency. Many people become worried when they find a lump, or what doctors call a nodule, in their neck. The first thought is often cancer, but it is important to know that the vast majority of thyroid nodules, more than 90%, are benign, meaning they are not cancerous. These benign nodules are simply overgrowths of normal thyroid tissue and usually do not cause any serious health problems. They can be solid or filled with fluid, and you can have one or many. Most of the time, they don't even cause symptoms and are discovered incidentally during a routine physical exam or an imaging test done for another reason. A common misconception is that the size of the nodule determines if it is cancerous. This is not true. A very large nodule can be completely benign, while a tiny, almost unnoticeable nodule could be malignant. Therefore, we cannot judge a nodule by its size alone. Instead, doctors look at other features on an ultrasound, such as its shape, its borders, and the presence of tiny calcium deposits called microcalcifications. Based on these features, they can determine if a nodule looks suspicious and needs further investigation. Relying on size is misleading and can cause unnecessary anxiety or false reassurance. The only way to know for sure if a nodule is benign or malignant is through a procedure called a fine needle aspiration biopsy, or FNA. During this simple procedure, a doctor uses a very thin needle to take a small sample of cells from the nodule. These cells are then examined under a microscope by a pathologist to check for cancer. The procedure is quick, safe, and provides a definitive answer in most cases. So, if your doctor recommends a biopsy, it is the most reliable step to get clarity about the nature of your thyroid nodule and to guide the next steps in your care. It is also important to clear up a very strange but persistent myth that personal relationships, such as having a difficult partner or an ex, can somehow cause thyroid nodules or cancer. This is completely false and has no basis in medical science. Medical conditions like thyroid nodules are caused by a combination of genetic factors, iodine intake, and other biological processes. They are not caused by emotional stress from relationships. Please do not believe such misinformation. Always rely on doctors and scientific evidence for your health information, not on superstitions or baseless claims you may hear from others. When a thyroid nodule is confirmed to be cancerous, such as papillary thyroid carcinoma or PTC, the treatment plan often involves surgery. PTC is the most common type of thyroid cancer, and thankfully, it is also one of the most treatable, with a very high survival rate. The standard procedure for many cases of PTC is a total thyroidectomy, which is the complete removal of the thyroid gland. This is done to ensure all cancerous cells are removed and to prevent the cancer from recurring or spreading to other parts of the body. Removing the entire gland is often the safest approach to achieve a long-term cure. After a total thyroidectomy, the body can no longer produce its own thyroid hormones. To replace this function, patients must take a daily hormone replacement pill, usually levothyroxine, for the rest of their lives. This medication does two things. First, it provides the necessary thyroid hormone to keep the body's metabolism running normally, preventing the symptoms of hypothyroidism. Second, it helps suppress the production of thyroid-stimulating hormone, or TSH, from the pituitary gland. Keeping TSH levels low is important because this hormone can stimulate the growth of any remaining thyroid cancer cells, so suppressing it helps reduce the risk of recurrence. However, not all nodules require surgery. For benign, non-cancerous nodules that are large and causing symptoms like difficulty swallowing, a feeling of pressure in the neck, or cosmetic concerns, there is a less invasive option called radiofrequency ablation, or RFA. RFA is a procedure where a doctor inserts a special needle into the nodule and uses heat generated by radiofrequency waves to shrink it. This is a great option for patients who want to avoid surgery and the resulting scar. RFA preserves thyroid function, meaning most patients will not need to take lifelong hormone medication afterward. This is only suitable for benign nodules, not for cancer. Ultimately, the right path depends on your specific diagnosis. If a biopsy confirms cancer, surgery like a total thyroidectomy is often necessary for the best outcome. If a nodule is benign but causing problems, RFA might be a suitable, less invasive choice. The most important step is to have a thorough discussion with your endocrinologist or surgeon. They will explain all your options, the pros and cons of each, and recommend the best course of action based on your test results, the nodule's characteristics, and your overall health. Do not be afraid to ask questions. Getting accurate information from a medical professional is key to making an informed decision about your thyroid health.